Next item, please.
Reports item 3A, Workforce Development Initiative, Medical Education. Assemblymember Dr. Jasmeet Bains will provide a brief report on a regional workforce development initiative.
City Manager Clay.
Yeah, thank you, Mayor and Council. We're very pleased to have our Assembly member here with us and staff present to talk about a workforce development initiative. This is consistent with many needs that have been identified in our community, as well as in our economic development workforce development studies, and a unique opportunity. And we'll turn time over to our Assemblymember Dr. Jasmeet Bains to fill council in on this topic.
Welcome, Dr. Bains.
Thank you so much, Mayor Go. It is an honor to represent Kern County in the Assembly, and it is an honor to be a native of Delano, and I am very honored to present forward my bill, which is AB2357, which is I dub the Grow Our Own bill. I announced this at the state of the county earlier this year, and I will be honest, I did not expect the outpouring of support for this bill right away after I announced it. There's been numerous organizations that have jumped on in support of this bill. I am very happy to announce that it has passed the Assembly floor. It has passed the Assembly appropriations as well. It passed recently out of Senate Higher Ed. It is going to be hitting Senate appropriations, then the Senate floor, then straight to the governor's desk. AB 2357 creates an endowment fund within the state treasury as a foundational first step towards establishing a University of California medical school in Kern County. Medical school will provide the catalyst we need to improve healthcare access for one of California's most medically underserved areas by training the next generation of medical professionals rooted in the San Joaquin Valley. In its research, the University of California identified the Valley as the state's fastest growing, most impoverished, and least healthy region of the state. The Valley has the lowest ratio of licensed MDs, DOs, NPs, RNs, marriage and family therapists, counselors, and social workers. And actually, as the past chair of the California Healthcare Workforce Policy Commission, I was appointed by Governor Brown. I spent 4 years on that commission. We worked to identify underserved areas of healthcare, and Kern County's ratios were staggeringly low. 1 to 33 was the ratio of primary care providers per patient. And literally in other parts of the state, it's 1 to 100. Kern County has some of the worst states in the country when it comes to the worst stats in the country when it comes to access to healthcare. The situation on the ground is expected to get even worse as we're hearing about physicians retiring early from burnout. I myself, a physician, am now in the legislature, but I still continue to practice because it is a big need to the community, and I can't do it alone. I need more and more help to make sure that people get the continuity of care that they deserve. The Association of American Medical Colleges has highlighted that many rural physicians are nearing retirement age, with nearly 25% expected to retire by 2030. At the same time, the number of medical school students from rural backgrounds who are the most likely to practice medicine in rural areas like myself declined 28% over the last 15 years. Currently, the number of medical students from rural backgrounds is just 4.3%. The number of medical students hailing from a rural area who are also part of an underrepresented racial or ethnic group is a staggering 0.5% of all medical students. I'll say that again. Black and brown kids from rural areas account for less than 0.5% of all medical students. By recruiting, educating, and training the next generation of physicians locally, the southern San Joaquin Valley can begin to erode the inequity of a decades-long doctor shortage that has contributed to the poor health outcomes of our residents. This bill is an essential step in expanding healthcare access, enhancing our local economy, and improving career pathways in the Valley. I'm really honored to see it go through. Support is joining as we speak. And I'm really proud to announce that the newest appointment by the governor to the UC Regents was a local person from Delano by the name of Brian Komodo. Just stopped by my office earlier today. And this is the first step forward to getting representation from the Valley on the UC Regents board, which has not been there. So this is a big step forward for our community. It's a big step forward to lay the foundation for this medical school. Like I said, I did not, when I first announced this medical school, I did not expect the alarming outpouring of support that it has gotten. I've had numerous colleagues also jump on in support, and it is gaining much momentum at a faster pace, and it's a long time coming for Kern County. So here to answer any questions that you guys might have. I'm literally just hitting every council in the district to make sure that we prepare and we know that this is going to be a future coming for Kern County.
Thank you, Dr. Bains. Thank you for being a champion for the Central Valley and for Kern County. It's very obvious in all of your actions that you're really looking out for us. So thank you for trying to fill this very important need. Councilmember Weir.
This is a great thing. If you can bring that here, that is awesome.
Not if, when.
Okay, I'll be there. But one of the things I want to bring up is when we have when we go in and pick what it is that we want to have happen over the next few years, every time we go in and think about what we're going to do over the next 5-10 years, it always includes a UC campus. So we've talked about that. I don't know. I've been here 18 years. That's a long time. I think we need to take that serious. It's a big wish, but it is the wish that we need. And I would ask staff to maybe present the initial thoughts and dreams that we may have and incorporate that with what our assembly person is already doing. So we don't want it to separate. We want it to be all together. And so we're reacting and interacting off of every edge of it. And so if we could do that and make that a priority maybe over the next month or two, I would really appreciate that. Thank you.
Thank you, Councilmember Weir. Councilmember Smith.
Thank you, Mayor. Thank you, Dr. Bains. I really appreciate the work that you're doing here and what it can do for the community as a whole. You said not if, but when. So what's our best case scenario when we might see something?
You know, when I had first announced it, you know, keeping history into consideration, Merced took 20 years. I was expecting maybe 10 years. With the momentum and the amount of support that's come out, time will tell. But if everything goes through and it gets signed, the endowment fund opens January 1st, and it will literally at that time determine as much contributions that come in on when this medical school will come. My guesstimate would be with the outpouring of support, maybe even in 5 or 6 years.
Awesome. Thank you. If obviously there's anything we can do, just let us know. Thank you so much.
Appreciate it. Thank you.
Call any others? Councilmember Gray.
Well, thank you, Dr. Bains, for coming, because we need doctors. We need, I can't even find a doctor in the city. It's a good thing I'm a healthy person, or I'd be in big trouble. So I have a doctor over in Santa Maria just because I couldn't find a doctor here. So we definitely need this. I think it's going to enrich our community in ways that, you know, it's just going to be amazing. So I'm just kind of curious if you have a site that you have your eyes on for this.
That is the most popular question, actually.
Okay.
Every council has asked that of me, and it's just too early to really set your eyes. I work as a doctor, so I triage. And right now I'm totally focused on getting this bill through the Assembly, through the Senate, which has already been through the Assembly, but through, and then once this endowment fund opens up January 1st, then we can definitely get down and roll our sleeves up and figure out where it needs to be. But right now, it's all hands on deck to get this through, because this, like Councilmember Smith and Ware had said, this is a long time coming. It's a wish come true. And one of the things that I did experience, which was sad, it was the first time I've experienced this, is Sacramento has this idea that kids in Kern are not the smartest. And one of the comments that was made in a meeting was, you guys have the highest illiteracy rates and the highest in education in the country. Your kids can't make that leap from this to medical school. And I said, and you should probably invest more in STEM and research. And I said, well, we will definitely invest in STEM and research, but that doesn't hold us back from this. And let me tell you this, what you just said is what someone said to me, and I am now a doctor and an assembly member. So don't ever say that about my kids.
Yes, good for you. I appreciate you being an advocate for us, because the sky's the limit with anybody that wants to put in the hard work and see themselves crossing over that bridge. They can do it. So that's great. You're a good cheerleader for us. We appreciate it. Thank you so much.
Appreciate it.
Dr. Bains, thank you again. Dr. Bains spends her week in Sacramento, then she comes and spends all weekend working with her patients. That's how much she cares about her patients and our communities. Thank you so much for your boldness also. We know that when pushback is there, you are very bold in making sure that you deliver for our community. So we just thank you for that. I was pleased to sign a letter of support on behalf of the city of Bakersfield for this bill. So thank you, and we wish you all the best and stand with you.
No, I appreciate the support. I'm a doctor first, politician second. Thank you.
Thank you.